Now, Spain has just recorded a record jump in daily deaths from coronavirus anywhere in the world. 950 people, as we've been saying, have died in the past 24 hours, bringing the toll there to more than 10,000. With another 8,000 people infected in the last day, the number of confirmed cases has now surpassed 110,000. These latest numbers put Spain on par with Italy. Well, now Marta Herrero is joining me live from Madrid. Marta, even more sobering figures today, and not only a new record for Spain, but the world too.
Yes, Natasha, 950 coronavirus dead in Spain since yesterday. Again, the deadliest day, and with more than 10,000 in total, the death rate rises to 9.07%. More than 800 new infections, reaching 110,000 of people that have tested positive from coronavirus in Spain. The 13% of these people still remain the healthcare workers, being the healthcare workers. There's still lack of medical supplies like testing. Many of them are battling in the front line of this virus without the protective measures, with symptoms, without knowing whether they're positive or not. And they're still running out of this gear. Despite the supply of the Spanish government this week and the distribution in all regions, it's not enough. They made a statement saying they don't want to become heroes or martyrs. They just want to deploy their task or their duties and work in safe conditions.
And Marta, it also seems there's no respite for Spain. I mean, on top of the ongoing battle with the virus and these awful figures, I see now some very disheartening numbers came out just in the last few hours when it comes to jobs too.
Yes, the economic consequences of coronavirus have caused a big impact in Spain. We woke up this morning with 900,000 jobs have been lost within the last 2 weeks since March 12th, and 2 years of job creation have been lost because of this. So now we have the unemployment rate we have the unemployment people in Spain, 4.5 million people that have lost their job in Spain, the worst rate since 2002.
Marta Herrero there for us in the Spanish capital. Thank you very much, Marta. Well, let's now get more on just how residents in Spain are handling the outbreak. We can speak to Mar Aguilera Vázquez, who's a professor of constitutional law at Barcelona University. But she joins us now from Igualada, a city under one of the most restrictive lockdowns in Spain. Mar, thank you so much for taking the time to speak to us today. I know the lockdown in your city has been described as a lockdown within a lockdown, and you've been living inside it for 3 weeks now, by my count. Can you describe for us what life is like there at the moment?
Yes, we are locked down inside a lockdown. So the situation here is strange because we cannot get out from our little city, Igualada. And it's not only that we cannot get out from our house, but since before the lockdown that was passed all over Spain, we were already locked down here in Igualada. But at the beginning, we could go out for a walk, keeping the social distance. We could go for a walk in the countryside because this is a small industrious city, so we could go for walks. But after the Spanish government passed the alarm state, we cannot get out from our home, and then we cannot go out from our city, from our area. So this is kind of strange. And the other thing is that it's reasonable we cannot get out from our area because we are a focus, but then we don't understand why other cities did not get locked down, although I can understand that there are cities that are more difficult to lock down rather than a city like mine, which is smaller. But still, we don't get why these differences happened.
Of course. I know that other residents of your city have been speaking about a sense of duty, self-sacrifice throughout this period. What's the mood there now after so many weeks? Especially, I believe your isolation has been doubled from 15 days to 30 days now?
Yes, for this, the government needs the approval from the parliament, from the Spanish parliament, from the Spanish Congress, and the Congress accepted this enlargement. So the first 15 days, the government just needed to inform the parliament, but to enlarge it for 15 days more, they needed the approval from the parliament by a simple majorities. And then this is what happened, that they enlarged the confinement. Then we were not sure if we would get rid of one of our confinements, which is rid from the fact that we are also confined here in Igualada and the other villages nearby. But no, the new decree that was passed by the government said that we kept being confined here in Igualada, which maybe it's not crucial because we are already here at home, but that means that if something happens, if we want to go to another hospital, we would need authorization. Even if we need to see our relatives, or there are, in some cases, inside the decree, you can move around, but not if you are from Igualada or from the other towns like Vilanova del Camí or Òdena. So if you are one of the persons living either in Igualada, Vilanova del Camí, Montbui, or Òdena, you cannot get out from these towns.
Sure. Ma, I do want to ask, because I see the numbers are pretty large there, something like 20,000 infections, and the hospital there incredibly overstretched. I imagine everyone there probably knows at least one person who's been infected or has passed on. How are people there coping day to day, psychologically?
It's really tough. We are scared, and I really would recommend people from all over the world to really keep the social distance, because when this started, people already knew what was happening in Italy, but we couldn't believe it. But we already had some small cases here. So I would tell everybody to keep the social distance, because it's the only way. Because when they will be aware, the situation will have been exploded. So it's very important that everybody stays at home and keeps the social distance, because now what's happening here is that people cannot go to funerals. They can not stay with their relatives when they are sick. The hospitals are packed. And then there are many, many deaths. Like last year in 2019, 47 persons died here in Igualada. This year, 140. So there is a difference. So even the numbers we have, they are dancing, because they are not real, because there are many people that has passed away without being diagnosed as COVID-19.
Ma Aguilera Vaquez there, speaking to us from Igualada, a city under one of the most restrictive lockdowns in Spain. Thank you for joining us.